Undergoing surgery can be a difficult and stressful experience. After all, you're letting someone you don't know rummage around inside your body, and there's always a chance that things could go horribly wrong. However, once the surgery is done, you can usually relax, knowing that the worst is over and that you're on the road to recovery. But what if your surgeon left his tools inside of you? Well, it wouldn't be the first time this kind of thing has happened. Surgeons accidentally leave equipment in their patients all the time. In fact, just look at poor Brainerd over here. We sent him in for a routine appendectomy earlier, and he ended up coming out with more than he bargained for. Fortunately, his surgeon is back, scrubbed up, and ready to get his tools back. So while he's playing operation with Brainerd, why don't we try and explain how he got into this mess in the first place? After all, you'd expect hospital staff to bring their A game during surgery, right? Well, as it turns out that, like the rest of us, surgeons and nurses are only human. However, while we're liable to forget our keys at home or our wallet on the subway, surgeons are liable to forget about needles and clips in your body cavities. Of course, recognizing the extraordinary circumstances that lead to this is important. Surgery is often an incredibly long, intricate procedure that requires expert communication between stressed-out hospital staff. In addition to this, the number of surgical materials involved can number in the hundreds. So, considering the situation, surgeons actually do a fairly good job at keeping mistakes at minimum. However, there are scenarios that do increase the likelihood of a forgotten object quite significantly. Like most people, surgeons are more likely to make mistakes when caught off guard. So it's not surprising then that retained object reports are way more likely when an emergency operation occurs, or when a standard procedure unexpectedly changes mid-operation. In addition to this, some surgeons like to listen to music while they perform surgery, as it can help increase their ability to concentrate and, we'd imagine, help a 12-hour surgery pass a little quicker. However, playing music can also affect communication and can lead to dire mistakes. So, now we know why things get left behind. But what exactly is being forgotten? Well, the answers to that question are endless. Scalpels, scissors, scopes, and even surgical gloves have been left in patients over the years. And it's not just equipment that begins with the letter S that you have to watch out for either. Towels, needles, clamps, and more can be added to the list of things that get forgotten in human bodies. However, the most common object left behind? The humble surgical sponge. Generally used to absorb fluids and clean wounds, surgical sponges are made of gauze and often end up packed in bodies and soaked in blood, giving them a kind of fleshy look that helps them blend in with your living tissue. On top of that, upwards of 100 sponges can be used during long procedures, which makes keeping track of them all and subsequently recovering each one all the more difficult. But really, what's the big deal? Is having a little ball of sponge in your body all that bad? Well, while you may think a sponge ball in your body is harmless, unfortunately, your body doesn't. Your immune system will go all out trying to fight this foreign intruder, which can lead to problems like fever and digestive issues. Of course, the effects of retained objects within your body can vary depending on what the object is and where exactly in you it was left. A sharp needle left near your lung, for example, or a surgical glove in your trachea could have disastrous consequences if left undiscovered. That said, having a foreign object in your body isn't all doom and gloom. Some patients can actually go months or even years before realizing they have something inside them at all. However, of the 772 foreign objects left in patients between 2005 and 2012, 16 cases ended up being lethal, and over 700 resulted in longer hospital stays. Numbers that are highly concerning for such a preventable mishap. Wait a second, what? There were 772 cases in 7 years? This kind of thing actually happens? Oh, you bet your bottom kidney it does. That's because while some hospitals have reported no retained objects for multiple years, others report one as often as every 3 months. Now you may think a hospital with no reports is really good at not leaving objects behind, and you may be right. However, it could also be that the hospital doesn't have a good system in place for catching and reporting retained objects. We're hoping it's the former and not the latter, but it's difficult to know for sure. You see, catching foreign objects can be surprisingly difficult if you don't have the right processes and equipment in place to do so. Objects tend to be either radiopaque or radiolucent, which are clever portmanteaus of the words radio and opaque, as well as translucent, respectively. As you can imagine based on the names, radiopaque objects can be seen in X-rays, whereas radiolucent objects can't. Because of this, even follow-up X-rays may not reveal the presence of foreign objects in your body, which is why hospitals have been turning to ultrasound devices instead. Of course, you'd only fire up the ultrasound machine if you know that something's missing in the first place, or if a patient starts displaying symptoms, and ideally, you'd want to prevent a mishap from occurring in the first place. So, what steps are hospitals taking to make sure this stops happening? Well, keeping a log of all materials checked in and out of surgery is definitely a good start. That way, if you're one surgical sponge short, you can scour the operating theater and, if necessary, dive back in while the patient is still unconscious. However, while these solutions seem simple, enacting them requires a systematic and comprehensive approach to changing the culture of operations and delivery rooms themselves in order to make them more attentive and communicative environments. Fortunately, programs have already been put in place to help facilitate that change. They include dual-person sponge counts, because it's always good to have someone double-check your work, improved disposal mechanisms, like clear plastic buckets instead of opaque ones, so you can visibly see what has been disposed of, and the close inspection of body cavities before they are closed, which you'd have hoped was happening already. The most important component of the program is actually placing a heavy focus on documenting and investigating forgotten object cases, including cases where an object was almost forgotten but was found in time. It's only by knowing how bad the problem really is that the hospitals can better tackle it. While it's nice to know that hospitals are trying to improve, that might not necessarily reassure you if you're being wheeled into surgery tomorrow. So, what can you, as a patient, do to make sure a surgeon doesn't leave his tools in you? Well, the most important thing is not to settle. Seriously, shop around a little. If you're having an elective surgical procedure done, you should feel free to check out different hospitals and surgeons. Ask them about how they handle forgotten tool situations and see how many cases they have had over the past couple of years. Feel free to be annoying about it. After all, the more you bring it up, the more likely the surgeon will be to double-check during the operation. The sad reality is that misplaced surgical objects have affected a number of very real lives. Back in 2010, a woman in the Czech Republic was shocked to discover she'd had a foot-long metal tube inside her abdomen for 5 months. Meanwhile, in California, a hospital was fined $50,000 by regulators when it was discovered surgeons had left a towel in a patient after surgery. And for some patients, a little medical malpractice can result in a big payday. In 2011, an Ohio man who'd had 2 towels left in his body came to a $25,000 settlement with the hospital. And if you think that's a hefty payout, just wait till you hear this next one. In 2009, a woman from Kentucky was awarded $2.5 million in damages due to a sponge left inside her after a hysterectomy. Don't be too jealous though. Part of the woman's small intestine had to be removed due to complications. And while a couple $1 million sure sounds cool, your health is much more valuable than that. While all this surgical nightmare talk probably has you a little on edge about trusting a medical professional ever again, it's worth remembering that the vast majority of surgical procedures go smoothly. While your chances of having a surgeon leave equipment inside you aren't zero, they are still fairly low. And with hospitals more aware of the problem than ever, those rates are dropping even further. Just do your due diligence beforehand, and you should walk out of surgery with no complications. All right, Brainerd, looks like you're all stitched up and ready to go. Wait, wasn't that surgeon wearing a watch before? Uh-oh. If you enjoyed this video, be sure to like and subscribe. Then head over to the Brainiac YouTube channel for more videos about medical mishaps.